Hey, it's Alicia. Grab your foam roller if you like the sound of following along with me as we release our adductor fascia. So this is the inner line of the thigh. This is where we can get into the groin tissue a little bit, and that adductor line of fascia that can get stuck to the quads. Up until I injured my MCL and ruptured it, that's the medial ligament here on the knee, I thought foam rollers sucked for releasing the adductors. And so the way that I have been teaching it has been to use a basketball. And the basketball is still great. I love the basketball, but this actually is better for addressing anything in the adductors if you've had a twisting knee injury like me, or your adductor has maybe taken over for a lack of gluteus medius activation perhaps, and you're getting overuse fascial restrictions on the inside of your thigh. So if this is an area you want to explore, grab your foam roller. We're going to do that in just a second. I want to quickly run through why you should do this, how it can help you. And then one thing to just keep in mind, because what I'm about to show you may not be the root cause of your pain if you're actually using this technique to address some kind of pain, but reasons to do it would be if you have a medial knee injury like I do, something with the MCL, or just a medial knee pain, maybe pain on the inside of your knee. If you have any kind of plantar fasciitis or heel pain that's showing up on the inside of your arch or the inside of your heel, this would be a great one to actually try. Or if you have groin strains or pain, pelvic pain, or SI or tailbone pain. Those are the primary ones that I'm going to say you should try this for. And of course, everybody really ought to do this. If you are watching this and you want to optimize your fascia head to toe, then this should be a body part you go after for optimization, even if you don't have pain, like any of the pains I just mentioned. So we should all be really taking care of our fascia head to toe, but those are specific reasons to do it. Now, if you find that your fascia is really restricted here on this inner line, that adductor line, it could be a result of pelvic instability, which I describe as one or more hip imbalances. So a hip hike or a hip tilt combined with one or more deep core muscles not firing. And in the case of your adductor, if it's really restricted, especially if you find adhesions or knots in there, chances are your gluteus medius in particular is not activating for you through your sports and activities, and this adductor line has taken over. And it's accumulating tension because it is being overused because your gluteus medius isn't activating for you. This is a huge reason I've seen in my private practice for people who have medial knee pain associated with glutes not firing, or that plantar fasciitis I mentioned with glutes not firing, or SI or tailbone pain, or any of the other things. Often the root cause is that underlying pelvic instability, which I describe as the hidden root cause of most head to toe pain. So if you feel like this is you, I invite you to go into the description box below this video and sign up for my masterclass called Understanding Pelvic Instability. It will make all of this make sense to you. But without further ado, I want to actually walk you through how to release your adductor fascia on the foam roller. All right, so the very first thing you're going to do for this is to actually get on your quads, just like I am, because this particular line of fascia in the adductors can be difficult to find on a foam roller if you go straight for the adductors. So I like to actually just start it here, and I'm going to be releasing my left adductor fascia. So I start on the quads, just directly on the roller, and then I kind of inch off of it, and I lay my right hip down and leg down on the floor. And then I'm going to just start with some slow rotations here to see if I can find the clunk. And it's a minor one for me right now, so it may not show up on video, but I've got it. So we can follow that entire line, and where you land when you first, get off the roller like I just did, I'm kind of in the middle of my adductor, towards the top. But I do want to explore the whole thing. So what I might do if I'm like, okay, well, I found it, right off the bat is stay in this one spot. Now here are your movement options for this technique. You can actually rotate it all the way down to the ground with your foot flat and then bend backwards. You could maybe squeeze there and see if anything happens. Squeeze your leg muscles. You could straighten it all the way out and then do some rotations with a fully straight leg. Now this may actually hide the adhesion. It does on me, but it might reveal it in your body. So I have to actually totally relax my leg there and I get a clunk. So these are your options. So you've got totally relaxing your heel, your foot, your toes, and mostly rotating your femur, that thigh bone. So I'm rotating from the thigh. So that's an option. I could do a circle where I go all the way to straight, kind of bend it back, all the way down to the floor, and then I straighten it out. That doesn't do a whole lot for me, but it might do something for you. So I want to give you those options. Now, if you want to roll up, you would just roll the roller towards your groin and then continue with the same types of movements. And if you feel like you ever lose the adductor line that you're on, you can start over in the starting position on your quads. That's probably what I would recommend, but you could also just play around with positioning the roller slightly differently just to see what that does. So yeah, that gets it pretty good for me as well. Or let's say you want to go closer to your knee, you just move the roller closer to your knee and very slow rotations to try to find it. So you're looking for an adhesion, you're looking for a clunk. You could stay totally straight. You could point your toes, maybe that does something, you could flex, but you're looking for your areas of tenderness, soreness, fascial restriction, adhesion, density, any of that. Now, definitely take note of how slow I'm moving. A lot of the time when we get on these areas of tenderness, we want to move fast because we want to get it over with. Slow movement is going to reveal the adhesions, whereas fast movement will typically hide them. And you can get pretty close to your knee here, but definitely check in with yourself and just make sure your knee feels safe, because I am getting very close to my knee here. But for me, with that MCL injury, this tissue has been traumatized. So there's tenderness there. I want to get into it. So we're literally going after the entire line from the knee all the way up. And you can go as high as you can maneuver the foam roller, basically. The whole point of this foam roller adductor technique is to really get at that line of tissue from your knee to your groin that is part of your adductor tissue getting stuck to maybe your quad fascia. So that is it. It's pretty simple. And as always, I recommend, taking your time, getting up and walking around if you feel like you need to in between. Generally speaking, we're doing 30 to 40 seconds per spot. If you're comfortable with fascia release like I am, I might spend 5 minutes on this nonstop. But I'm moving really slow. There's no nervous system activation in me. So if that's you, feel free to stay on here as long as you want. If you're getting nervous system activation, like some kind of fight, flight, freeze, if you're sweating, if you're feeling reactive or emotional, I recommend taking it 30 to 40 seconds at a time. All right, so that's what I have for you today, that adductor on a foam roller. I would love to hear any comments from you. I have started asking for your likes on YouTube and your comments because I have figured out we're being shadow banned a little bit here. Every thumbs up really helps us get this video out to the people who need it. And of course, if you comment, that helps us out even more. And I really love getting into the comments section and actually talking to those of you that put your thoughtful, meaningful comments below the video. So if you share something thoughtful and meaningful, I will get in there and talk to you. If you have any questions for me about this as well, post them below, and I will see you next time.